All right, good morning, everyone. Thank you for joining today's 1-hour session on one-session alcohol, vaping, and marijuana use prevention, introduction to prevention plus wellness programs. My name is Dr. Chudley-Wirch. I'm president and founder at Prevention Plus Wellness, located here, beautiful, and today hot, Jacksonville, Florida. And yeah, it's already looking at the temperature's already well into the 80s. Woo, it's gonna be warm. I hope it's nice where you're at. Thanks for joining us. We have a sold out webinar. That's why we're offering a second one tomorrow or next Wednesday, same time, 11:30 a.m. 11:30 a.m. East Coast, 8:30 a.m. Pacific Coast. So another session. I will send all of you who've registered for today's session a link to this recorded webinar, a PDF of the slides for today's presentation, a certificate for 1-hour CEU, which you just type your name in, print out a copy for your records. And as I said, a link to another session, another live session of this exact same webinar 1 week from today for those of you that couldn't get in or that know somebody that would like to attend it. So do please share widely these materials with your colleagues throughout your region and your state. So we've got 1 hour together today. We got lots of slides, lots of information. If you've been to some of our webinars in the past, some of this may be a review. That's all right. Doesn't hurt to have a review. But there's a lot of new content as well, especially for those of you that are new to Prevention Plus Wellness. And so I think I'm hoping at least you'll learn some new information that may be of use to you. You guys are the ones on the front lines making a difference in the lives of youth, young adults, sometimes adults, certainly families and communities. God bless you for all you do. You're making a real difference. Keep up the good work. Anything I can do to support you, please let me know. We'd be happy to do that at Prevention Plus Wellness. So let's go ahead and take a look at the objectives for today's webinar. So here we go. Here they are. There's 4 of them. So today we'll be examining alcohol, vaping, marijuana use prevention plus wellness, or we refer to that as PPW, prevention plus wellness, screening and brief interventions. All PPW programs are screening and brief interventions. Secondly, we're going to list differences between typical substance use prevention programs and PPW programs. Thirdly, we're going to explore theory as well as research which supports brief and multi-health risk behavior interventions, of which all Prevention Plus Wellness programs. PPW programs are brief and they're multi-health or integrated interventions. Lastly, we'll describe options, settings, steps, and adaptations for implementing and evaluating Prevention Plus Wellness programs. So let's take a look, first of all, at some of the programs and their components. We'll start with sport, Prevention Plus Wellness. Some of you may be aware of this, may be knowledgeable about this. Actually, you know what? I forgot. I did want to share a poll with you. We're gonna go past it now. I wanted to get some feedback for you. If we have some time, I'll pull up the poll at the end of today's session. We got a lot of slides, and it'll probably take a whole hour. If we have some time afterwards, we could look at the poll and see what the results are, and then you could ask questions using your live chat option. So find that live chat as we go along. If you do have questions, you can type them in, and we'll go to the first come, first serve. So whoever asks a question first, will address that first. So if you have a question, you have a comment, find the live chat and you can type it in as we present. And then if we do have some time at the end, I'm happy to stay, by the way, as long as you want to stay to talk about these things. Sport, Prevention Plus Wellness. is evidence-based, and it's been proven through rigorous controlled trials to prevent alcohol, tobacco, cannabis, and increase physical activity among general populations and substance using youth populations. Sport, PPW, targets physical activity and sports, but that's where the name comes from, healthy eating, sleep, and to a lesser extent, stress control. It is a single session intervention. It can be implemented in this, I think, as brief a period as like 30, 35 minutes, 50 minutes, somewhere in between there, depending on how much time you want to spend on it. It's screening and brief intervention, or SBI, as we refer to, SBI, screening brief intervention. Sport comes in high school, middle school, and elementary school versions. It is implemented with PowerPoint slides. It is scripted, and you can provide it, and there's two scripts. You can provide it either individually to youth, one-on-one, or in a group. It is based on or founded on marketing theory, which targets positive images, which is why it's one of the many unique aspects of all prevention plus wellness programs. Sport includes optional parent materials, specifically a letter for parents and 4 weekly flyers. That's an entirely separate intervention within sport. It's an optional tool. Sport PPW also, it comes with a manual with your scripts and reproducible materials in a digital download. You just copy it to your computer, whatever device, and you can go present that program to countless young people. Lastly, we've made adaptations and now include online protocols. So we have online protocols so you can present your sport PPW program, not just face-to-face, but also online. And that's very timely for what's going on in our world regarding the coronavirus. So sport PPW for youth, evidence-based. We also have a parallel program called InShape Prevention Plus Wellness for young adults. It's being used in college campuses, in communities, in the military, particularly in the Air Force, and also evidence-based, proven to prevent alcohol, drinking, driving, cannabis, increasing physical fitness, as well as sleep, health-related quality of life of young adults. And other than that, pretty much the same as the sport program. We're not going to really be focusing on InShape, so I'm going to move right on to Vaping Prevention Plus Wellness. Vaping PPW is a modification or adaptation of the sport program. It's considered an evidence-based screening and brief intervention practice, and we consider it an evidence-informed program in that it is founded on the sport program. Vaping PPW targets e-cigarette use, physical activity, healthy nutrition, sleep, and stress control. It is a single session, screening and brief intervention. Just like sport, we have a high school, middle school, and elementary school version of Vaping PPW. It is implemented with PowerPoint slides. It comes with a manual with scripts to provide it one-on-one or in a group, except for the elementary school version, which just has the group script. Based on the same marketing theory that targets positive images, we'll talk more about that today, includes not just a manual, but a digital download of all reproducible materials and your PowerPoint slides, and again, online protocols if you want to provide the Vaping PPW program online. So you've got sport PPW, vaping PPW, and lastly, marijuana prevention plus wellness. And again, the key difference here is that the marijuana prevention plus wellness program targets cannabis use. All the rest is the same as the sport prevention plus wellness program, as we've discussed with the other programs. So let's take a look at and compare and contrast substance use, typical substance use prevention programs with the prevention plus wellness programs. In the left-hand column, you see typical prevention programs, right-hand column, prevention plus wellness programs. And so let's compare them side by side. If you start in the left-hand column under typical prevention programs, number one, Most substance use prevention programs address one, sometimes they address more substance use behaviors. If you look to the right, prevention plus wellness programs address substance use, one or more behaviors, but also chronic disease risk behaviors. So within all prevention plus wellness programs, we address physical inactivity or sedentary lifestyle, poor nutrition, inadequate sleep, and daily stress. So that's a major difference. Go back to the left, typical prevention programs, number 2, usually they include multiple sessions. They're educational in nature, as number 3 shows. And so they could be 6 sessions, 10, 15, 20, or even more, could be multiple years. If you look across to the right under number 2, prevention plus wellness programs, with the exception of Sport 2, are all a single session. And they're able to do that because if you drop down to number 3, they're a motivational screening and brief intervention. So less educational, more motivational, more designed to get young people to initiate behavior change right off the bat. And then if you look again in the left-hand column, the last item under typical prevention programs, they address substance use risks and sometimes resilience or resistance, I should say, skills, resistance, skills to resist offers in particular. If you look to the right, under prevention plus wellness programs, number 4, also address substance use risks, but then there is a major focus on self-control or self-regulation skills and using desired future images to increase motivation for change. We'll talk more about that today. And then let me go on and say that there are some other unique things related to the prevention plus wellness program. Some of these things you'd see in some substance use prevention programs, but not generally. So for example, number 5, prevention plus wellness programs promote habits which improve mental and physical health. So it's not just about avoiding substance use, which is critical, but also promoting these healthy habits or wellness habits that promote physical mental health. That is physical activity, breakfast, healthy breakfast, other healthy nutrition, adequate sleep, controlling stress. Number 6, PPW programs include multi-health behavior goal setting. So whereas some substance use prevention programs, you might find them on occasion having a contract or pledge to avoid substance use, prevention plus wellness programs have a multi-behavior goal plan and contract. So not just to avoid substance use, but also to increase protective wellness habits. Number 7, PPW programs, unique to PPW programs, number 7, is that they have scripted content. That increases the fidelity of implementation over time and across provider and the ease of use. Number 8, PPW programs promote tailoring. So unlike other evidence-based programs, other evidence-informed programs, we really believe certain level of tailoring is possible, I should say, and may be desirable. And we show you how to do that, and it's quite easy using our PowerPoint slides. Number 9, PPW programs have optional implementation methods. We mentioned this already. You can implement them one-on-one, you can implement them in a group, and now you can provide them as well online. And lastly, number 10, prevention plus wellness programs have built-in immediate pre-post surveys. So you can determine immediately before and after the lesson, within that one period, whether you've had a significant or a considerable improvement in measures associated with the targeted behaviors, not just substance use, but also the wellness behaviors. And we do provide a certain level of free analysis related to those pre-post surveys. All right, now let's take a look at prevention plus wellness programs, how they address substance use and CDR, which is chronic disease risk behaviors. Here's the high school version of our programs. So you have obesity, screen time, physical inactivity. Those are all associated with chronic diseases, and those are addressed by promoting physical activity and sports participation in our Prevention Plus wellness programs. Environmental influences for sedentary living are addressed in PPW programs by promoting awareness of environmental influences, particularly friends and family. Unhealthy eating as a chronic disease risk behavior is addressed in PPW programs by promoting healthy breakfast eating as well as other nutritious foods. Lack of sleep is addressed by promoting 8 or more hours of sleep. Alcohol, cigarettes, and marijuana and other drug use are promoted in terms of avoiding those substances as being counterproductive to wellness lifestyles. And then lastly, uncontrolled daily stress is promoted through the promotion, I should say, of relaxation strategies. So that's how Prevention Plus Wellness addresses substance use and chronic disease. The practice model for all Prevention Plus Wellness programs is screening and brief intervention. It's considered an evidence-based practice according to the Substance Abuse and Mental Health Services Administration, or SAMHSA. 3 steps to screening and brief intervention that is used in Prevention Plus Wellness programs. Step 1, you screen participants for their current health habits using a screening survey. This includes not just substance use, but also protective wellness habits. Secondly, you provide feedback about those wellness habits, and that feedback includes positive image messages. You use your script in your manual, you show your PowerPoint slides, and this is designed to increase motivation for change. And then lastly, capitalizing on that, you give youth, participating youth or young adults, an opportunity to set and monitor goals to not just avoid substance use, but increase or improve healthy behaviors by setting those goals and monitoring them over time. 3 steps: screening, feedback, and goal setting. Screening, brief intervention. What's the evidence supporting screening and brief interventions? On the left-hand block, you can see that there was a review of research about 5 years ago. The review of all the published research, which showed that screening and brief interventions were effective for up to a year after receipt with adolescents and young adults. Very promising. And then to the right, we've done our own research over time showing that Prevention Plus Wellness program screening and brief interventions are effective, with some effects lasting even a year later from a single session. What other support is there for screening and brief interventions as evidence-based practice? Well, as I mentioned earlier, the Substance Abuse Mental Health Services Administration has identified screening and brief intervention as an evidence-based practice. This includes SAMHSA's SBIRT, screening, brief intervention, and referral to treatment. In addition, Centers for Disease Control and Prevention has supported alcohol screening and brief intervention in primary care settings. The World Health Organization supports alcohol screening and brief intervention. In addition, the National Institute on Alcohol Abuse and Alcoholism supports alcohol screening and brief intervention for youth. And the American Academy of Pediatrics supports substance use, SBIRT, or screening, brief intervention, referral to treatment for youth. Lastly, the National Institute on Drug Abuse supports adolescent substance use screening for screening and brief intervention. So you have all of these very well-known national, federal, and even global institutions supporting screening and brief intervention. What's the evidence supporting Prevention Plus Wellness screening and brief intervention? Well, we'll just take a look at the evidence for sport, because we're really focusing on sport and adaptations of sport, including the vaping and the marijuana Prevention Plus Wellness program. So sport has had a number of peer-refereed published research papers showing its effects, its positive effects, and these have been reported because of the quality. They include randomized controlled trials, community-based trials. And if we just summarize all of the effects across those multiple articles that were published, we can see that sport as a single session intervention has been shown to significantly decrease alcohol use initiation, as well as quantity and frequency, plus binge drinking and alcohol problems, while significantly increasing physical activity among participating youth. It reduced cigarette smoking with some effects lasting even a year later. It reduces binge drinking, smoking, and marijuana use, and increases physical activity among drug users even a year after that single session. Sport PPW increases parent-youth communication. Under number 6, we did a trial of 3 of the 4 parent flyers which come with the sport program, and the flyers reduced alcohol use, problems, and marijuana use, and increased parent communication. And lastly, a Turkish translation of sport and a trial in Istanbul was shown to improve indices of physical activity, nutrition, sleep, and mental health among participating youth compared to control youth. So really good outcomes from sport. In addition, we have quite a bit of feedback from participating youth in their own words, so qualitative data, including these comments directly from youth who received sport, like number 1, I liked how it told us about drugs, what drugs and alcohol can affect your life and your friends. Number 2, I like the fact that it lets you set your own fitness goals to help you stay fit. Number 3, I like that it tells you what you should and can do, like actually eat healthy and eat breakfast or do exercise. Number 4, knowing that I don't have to be skinny to be healthy. Number 4. Number 5, it'll change my mindset. In other words, motivate me to live a healthy lifestyle, and that it was fun. So a lot of different topics are being addressed by the comments that young people are writing in evaluations of the sport program. You can find the published papers and read more about the effects and effectiveness of sport PPW on our website. And sport, as well as InShape Prevention Plus Wellness, are considered evidence-based programs. That means they're research-founded, they're research-based, and then they're listed on evidence-based registries like these, Blueprints for Healthy Youth Development. You can see some of the list there. You can find more about that in the evidence-based registries on our website, preventionpluswellness.com. Now let's take a look at Prevention Plus Wellness targets, how it targets substance use risks and self-control skills. So the underlying conceptual model that I had alluded to thus far is the behavior image model. The behavior image model is a marketing-related theoretical roadmap for developing brief programs that integrate or connect the promotion of wellness with the prevention of substance use. Now, there's 2 components to the BIM model, the behavior image model. The first component is the assumption is that you can use positive images and communication to increase motivation for change. And the second is that you can use multiple behavior goal setting to increase self-control or self-regulation skills. Both of these assumptions have been proven to a certain extent with the studies that we've provided and the implementation of sport, vaping, marijuana, and other PPW programs throughout the country and abroad. Prevention plus wellness programs address substance use risk, a number of them. So for example, go down the list here, starting on the very top, substance use as a barrier to each of the targeted wellness behaviors, including, in other words, how vaping or marijuana or alcohol in the sport program is a barrier to and interferes with physical activity, nutrition, breakfast, sleep, stress control. Also, how in these individual substances, whether they're e-cigarettes in the vaping PPW program, marijuana in the marijuana PPW program, alcohol in the sport program, how those substances harm your fitness and health, how they cause life problems. Also addressed in the content of Prevention Plus Wellness program are myths associated with these substances, that most youth do not use them, which is a social norm message, healthy alternatives to these substances, choose for yourself, plan ahead, and recommendations for increasing overall wellness, which includes avoiding vaping, cannabis, and alcohol use, as well as increasing protective wellness behaviors. Let's take a look at some of just some sample slides and content from the sport Prevention Plus Wellness program. This is the high school version. So here you can see this slide. You got positive images, you got positive comment, you got the linking of an active life and alcohol don't mix, alcohol and drugs can hurt, relationships, how well you do in sports, how you feel about yourself, energy, and how you do in work and school. So you're linking, again, wellness and productivity and success and performance with the avoidance of substance. In this case, this is sports, so most of the content is addressing alcohol. Here's another message: alcohol, marijuana rob your body of vitamins and minerals. They lead to weight gain. They can sap your energy needed for sports, physical activity, life. So this is a nutritional related image, and there's some pictures of a high school age youth eating healthy. Here's a message about sleep: alcohol, tobacco, and drugs disrupt sound sleep. Stop deep sleep patterns needed to maintain an active and high energy life. So you can see how we link the substance with the interference with the behavior and the positive benefits and images. And here's just more of a generalized comment about how alcohol and drugs put you at risk for various life problems, embarrassing yourself in friends, which is very, very important and motivational to young people, getting hurt, sick, getting into trouble with family, school, police, and so forth. Let's take a look at some sample vaping prevention plus wellness messages. This is the elementary school version of the vaping prevention plus wellness program. And you can see the great looking images there of young people having fun, running, playing, and the key to fit and healthy mind and body, lots of physical activity, and linking it with staying away from e-cigarettes and even regular cigarettes. So linking those messages. Here's a nutritional message: e-cigarettes use candy and fruit flavors appealing to youth. Vaping can reduce the body's use of vitamins and minerals. Withdrawal symptoms, and you're gonna have to describe that for your young, for the children, can make it hard to eat healthy and be active. Here's a message about a couple of messages you'll see here. Studies show most kids do not use e-cigarettes. That's a social norm message. And you can increase your skill to say no to e-cigarette offers by practicing. So there's a resilience or a resistance message, I should say. And there's a great picture of some kids having fun, healthy, happy, socializing. So to keep a healthy brain and body, have more energy, look and feel good, do better in school and sports, stay away from using all e-cigarettes. So we're linking in these positive outcomes, benefits, images with staying away from e-cigarettes, and great image of happy, healthy, diverse kids. And lastly, here's a sample of marijuana prevention plus wellness message. This is a middle school program. And so again, active life, marijuana don't mix. Marijuana can hurt your brain and lungs. How well you do in school and sports. Great image of a young person riding a bicycle. Here's a message about nutrition again. Marijuana leads to eating junk foods and weight gain. Can sap your drive to do well and spend time with family and friends, and withdrawal symptoms can make it hard to eat healthy as well as be active. Here's a sleep message. Marijuana harms your ability to think clearly, leading to lower grades. Cannabis is linked to increased depression, anxiety, drains your energy needed to be active, whereas sleep increases that energy. And lastly, here's a general slide and content about life problems. By not using marijuana, you'll not have to get in trouble with parents, police, friends, school. You'll not harm your brain, ability to learn, your grades, lungs, physical fitness. You won't become depressed or seriously anxious or become addicted if you can avoid using cannabis. In addition to those sample messages, those positive images we just showed you, I just showed you here, the Prevention Plus Wellness program, again, as I said, in the behavior image model, in addition to addressing positive images, it addresses self-control skills, in particular, self-regulation skills to set and monitor behavior goals, including the avoidance of alcohol or e-cigarettes or marijuana, depending on which program you're using, as well as other drug use, and the improvement of one or more protective behaviors and a public contract. So it's goal planning and a public contract, which increases significantly motivation for change. That's what you'll find in Prevention Plus Wellness programs. Now, you can learn more about how Prevention Plus Wellness program by going to our website, preventionpluswellness.com. There's a link to our logic model if you want to learn more about the connection between the inputs and the outputs, what goes on with the program, the flow, and these logic models are very important to understanding the change process. And oftentimes when you're writing grants, the funding agency will want to know more about that. So Prevention Plus Wellness addresses peer and desired future images. Let's go back to that topic and how does that happen? Well, why positive images? Because positive images are effective. And this is supported in 3 ways. Number 1, image, just generally speaking, has a conceptual support in a number of health behavior theories, including possible selves. In other words, if people, including young people, can think of a future self, that could be very, very motivating for them. So that does drive their choices and their behaviors. And Prevention Plus Wellness programs harnesses that motivational power by focusing on possible selves. Secondly, image has been supported in research through research on self-concept, prototype images, possible selves, and positive identities, which are linked to the youth health risk. So research supports images and the power of images and the influence and predictive ability of images in shaping healthy behaviors, including substance use among youth. And lastly, we have seen decades of practical application and use and support for appealing positive images in advertising and marketing by the world's largest corporations. And ever since modern marketing has developed in the early to mid 20th century, we have seen positive images like this one on the right being used to promote products. And what we do at Prevention Plus Wellness is to harness that powerful marketing tool, positive images, to promote positive wellness lifestyles, including the avoidance of substance use. How are these messages constructed, these multiple behavior messages using images? Well, the goal, first of all, to state it, is to trigger a mental picture of the healthy behavior and how a substance using behavior or behaviors harm it through using vivid terms and illustrations. Now, there's 2 components to the construction of these messages. And the first step is to present positive, desired future and peer images and other benefits associated with a particular health enhancing behavior. That could be physical activity in the last year, or regular physical activity, or eating healthy breakfast, or getting 8 or more hours of sleep, or controlling stress. That's the first step. You trigger or you cue positive images, desired future images, peer images associated with that desired behavior. And that increases motivation for change. And then you link out one or more substance use behavior is a barrier or represents a feared image associated with that wellness outcome. How does that work? Let me give you an example. So step 1, positive images and other benefits of health enhancing behaviors. Here's an example. There's a quote: young people who engage in regular physical activity tend to feel energetic, sleep better, and look more active, fit, and confident. So here you've got the target group, young people. You can see the image to the right. You've got a young female doing some running in cold weather, obviously. And you've got the wellness behavior being physical activity, regular physical activity, in fact. And then you've got the benefits. And the image benefits are underlined: energetic, active, fit, confident, very, very motivational, but also other benefits, including sleeping behavior. So that's step 1, triggering and using these image terms and illustrations so that young people can see themselves in those pictures or see models of themselves or representations of themselves, both genders, different ethnicities, different types of positive activities. And then you highlight these outcomes, these benefits. And then the second step is you link how substance use is a barrier. So here's an example of it in the quote: marijuana use reduces your energy level needed to participate in regular exercise and to achieve your fitness goals of being in shape, looking good, and feeling fit and active. So that's a very simple application. 2 steps: cueing positive images associated with wellness behavior and linking how substance use is a barrier to that. Prevention plus wellness programs promote habits that improve mental and physical health. Let's just take a look at common prevalence of common substance use among high school students throughout the country, according to Youth Risk Behavior Survey. You can see here that the majority of young people, 6 and 10, are likely to have ever used alcohol, and that's followed by vaping e-cigarettes, which is followed by marijuana, and then regular cigarettes. So that's the prevalence of ever use among high school students throughout the country, and it gives, I think, some suggestions as to prevalence or priorities for targeting your prevention messaging. But at the same time, young people are likely to experience chronic disease risk behaviors. And so there's the percentage of behaviors that are associated with chronic diseases. The most prevalent is not getting 8 or more hours of sleep and not getting 7 days of physical activity. And that's followed, and with 3 out of 4 youth not getting the required amount of sleep and activity. That's followed by not eating breakfast every day of the week, with 3 out of 4 youth not doing that. If you look at fruits and vegetables, very small group numbers are even getting 3 fruits and vegetables, let alone 5 or 7, and so forth. So these are chronic disease risks also going on at the same time. So multiple risks are what young people are experiencing today. Throughout our country and other developed countries, it's common for adolescents and young adults to be experiencing multiple health risks. So one study, a national study, showed that over half of high school students were engaged in 2, sometimes 3 or 4 more risk behaviors. And they recommended interventions at the clinical and community level that target multiple risks because of the prevalence that young people, in other words, most young people are experiencing more than one risk at the same time. And that the interrelatedness of these health risk behaviors should be addressed in interventions like prevention plus wellness. If you look at the other side of the coin, there are many benefits to a healthy lifestyle. That's the kind of a lifestyle we're talking about is regular physical activity, nutrition, sleep, controlling stress. And here are the benefits according to research: improved physical and mental health and quality of life, more positive self-image, self-esteem, self-regulation, self-confidence, and life skills. Number 3, particularly related to those of you that are substance use specialists, prevention specialists, mental health specialists, healthy lifestyle is associated with less depression, less anxiety, and less alcohol, tobacco, and illicit drug use, as well as unsafe sex. Greater brain development, cognitive functioning, more opportunity to socialize, have fun, and develop friendships, greater academic success as measured by less suspensions, greater attendance, less dropouts, and more likely to attend and complete college. And lastly, healthy lifestyles associated with less chronic diseases like heart disease, diabetes, cancer, stroke, obesity, and osteoporosis. A lot of benefits from a healthy lifestyle. Multiple risk behavior program efficacy or effectiveness has been shown in a couple of really important reviews of research. I like to look at the reviews because rather than a single study, it takes a snapshot of multiple studies. So it gives you a much better view and more confidence of the science. And here we see 2 conclusions from 2 different studies. The first one on top shows that integrated prevention programs are feasible, and they may be more effective than discrete interventions. That's a review in 2014. In other words, a study showed that interventions that link and address more than a single risk behavior are more likely to be effective and are feasible. The second review showed that universal school-based interventions that address multiple risk factors have a role to play in preventing tobacco, alcohol, illicit drug use, antisocial behavior, and improving physical activity. So two very, very good reviews showing multiple risk behavior programs appear to be feasible and have a certain level of effectiveness. Let's take a look at Prevention Plus Wellness program implementation issues. So all Prevention Plus Wellness programs use scripted content. And so the advantage of that under the pros heading are that it makes it easier to use them, lessens training time, increases the fidelity and reliability of your implementation, and it allows, number 4, less skilled people to implement it. So there's no requirement for previous education or experience, and that's why we have we train youth to be youth leaders to implement Prevention Plus Wellness programs, because you have that scripted content. It's easier to provide. As far as the cons go, or the negative side of scripted content in interventions, it requires some practice. It's initially may feel a little unnatural, and you have to have that script in hand. However, you could address those issues, particularly number 2, by practicing. Once you practice the script, that initial feeling of being unnatural becomes very natural. At least that's been our experience and experience of others throughout the country that are providing Prevention Plus Wellness programs. What are the steps for pre-implementation, implementation, and post-implementation of Prevention Plus Wellness programs? So these are pre-implementation steps. First of all, you receive online or on-site training as a program implementer. You don't need the training. We highly recommend it. And our experience has shown that if you get the training, you're much more likely to follow through with implementation and to have an effective experience with implementation. Secondly, you practice both of your scripts. Now, if you're only going to implement the program individually or in a group, then you could just focus on practicing that script with your PowerPoint slides. And then lastly, you make copies of all your materials so that you can present your lesson. That includes your screening survey, pre-post survey if you're going to use those, your goal plan, your instructor survey if you're going to use that. So you have everything built into your program with that one purchase. No need to ever purchase anything other than that. No other materials for the providers or for students or for participants. The implementation steps are these. In a semi-private setting, you implement the script. You use the script and you implement the screening survey. And if you want to, a pre-test. You show your PowerPoint slides during the script messages, and you present this either, again, one-on-one, individually, or in a group, or online. You read and assist youth to complete goals that are achievable in 1 week. You co-sign the plan and ask participants to post and monitor their daily goals. Remember, those goals are to avoid substance use and to increase protective wellness behaviors. You administer an optional post-test if you wish, and you collect pre and post surveys from each participant if you decide to do that. Post-implementation steps. Number 1, you complete an instructor survey to monitor quality. So we give you the tools to monitor fidelity and effectiveness of your program. You scan your participant pre and post test surveys, and then you email them to us, and we'll run a free analysis for you if you choose to do that. We also have optional online pre and post surveys, as well as an optional online goal setting if you present your program online. Number 4, you use the findings that you get from your data you've collected from your pre-post surveys and your instructor survey to promote and improve your program over time. Even though you're using evidence-based and evidence-informed programs, we strongly feel it's important to be data-driven, to use the data in your setting with your population, with your organization, with your providers, to see how well your program is doing and to make sure you continually improve it over time. You follow up with your participants, and you maintain your 3-year program implementer certification. If you're a certified program implementer, that's that online or on-site training, 2-hour live to become a certified implementer. Sport in particular is implemented throughout, it being implemented in all 50 states of the nation and abroad. And here are some of the places where it can be provided, not just sport, but also vaping and marijuana prevention plus wellness and all PPW programs. They are being used and can be used in school health, PE, lunch, and suspension. In other words, they can be used as a primary or a universal prevention intervention, as well as a selected and indicated prevention intervention. After school, community sports, recreation clubs, youth and family organizations, boys and girls clubs are using our prevention plus wellness programs. YMCAs are using them. Youth and peer leadership training in clubs. In other words, young people are being trained to provide this single session lesson, whether addressing vaping or cannabis or alcohol with sport, to their same age or younger age peers. Hospitals, health clinics, sports, school physical exams, faith-based organizations. We even have a faith-based adaptation of our programs called In God's Image that addresses not just substance use and healthy behaviors, but also spiritual habit. Juvenile justice, homes, college campuses, dorms, wellness events, counseling, and the U.S. military are all implementing prevention plus wellness programs. Now you have 3 options to consider with PPW programs. Option number 1, do you want to present your prevention plus wellness program as a standalone program? Or do you want to add it to and include it among other prevention, health, sports, fitness, recreation, intervention, or treatment programs or activities? That really depends on, what else you're doing within your organization and your setting, and whether you can integrate it with these other things. Number 2, you can provide your PPW program one-on-one or to youth and young adults individually or in a group. And thirdly, you can present it in person or now also online. You also have some follow-up options. If you want to follow up with youth beyond that single session screening, feedback, and goal setting intervention, you could re-administer your PPW program, your screening and brief intervention every 6 to 12 months for as long as you want, for as long as you have it. Secondly, you can meet with the participants weekly to discuss goal successes and rewrite goals every week or every month. That focuses on that self-regulation or self-control skills piece of the intervention. You can implement follow-up parent flyers, which are found in your sport program. You can use online youth and teacher resource to extend and enhance your program, which are found free of charge on our website, preventionpluswellness.com, under the tools heading. And then lastly, you could implement additional lessons. So for example, we have a Sport 2 Prevention Plus Wellness program, which is actually our only multi-session intervention. It has 6 sessions in it. As I said earlier, Prevention Plus Wellness programs allow tailoring, and sometimes we even encourage tailoring. So we allow you and help you adapt to the setting and population. And the easiest thing you do is to switch out images in your PowerPoint slides. To give you a couple of examples of that, in Montana, some of the images of I think it was the Sport Prevention Plus Wellness program, of kids involved in organized sports like basketball and so on, were switched out with field settings, with outdoor activities, which are much more common in mountain settings, including hiking and snow skiing and fishing and that kind of thing. A perfect adaptation, a perfect customization. In the use of our InShape Prevention Plus Wellness program in the U.S. Air Force, some of those images were switched out with images that showed men and women in uniform. And there was a little extra content added, which addressed high caffeinated drinks, which were an issue on the base. Content can be changed to a certain extent, and we can work with you on that if you have a word or two or some issues there. As we just gave you an example of that. And co-branding, you could put your own image. I should say you can put your own logo, colors, on your PowerPoint slides and make them your own. So a lot of opportunities and options for tailoring. We work with you, we help you do that if that's something you want. As I mentioned earlier, we have remote online program tools. On the left, we do have an online Prevention Plus Wellness Goal contract. This is particularly helpful if you're providing your program online. And then to the right, we have online youth substance use prevention program pre and post surveys. In other words, you can give a link to the youth and have them completed online so you don't have to collect anything. So it saves everybody time and energy, and yet you have access to your data. And both of these, the online goal plan, the online pre-post test, we can give you a customized link just for your organization. So just your organization will have their data separate from everybody else's. There are a number of training opportunities offered at Prevention Plus Wellness. We have been at least regularly every week or two providing under number 1, the Prevention Plus Wellness program online strategies training. It's about an hour in length. There's the last recorded session. You could click on that and view that if you'd like, if you're interested in that. Also, we offer under number 2, online Prevention Plus Wellness program implementer training, 2 hours live training. We also offer number 3, 2 hours live train the trainer program. And lastly, as I said earlier, under number 4, we have youth leadership training where we could train youth, or we could train you as a trainer to train youth to provide the single session sport prevention plus wellness, vaping PPW, marijuana PPW, or one of our other prevention plus wellness programs to their same age or younger age peers. You can learn more about Prevention Plus Wellness programs at Prevention Plus Wellness. Under programs, you can see a new catalog. That's the simplest way to look at all of our programs, or at least our most popular programs. And then also, there's a link to the lower right where you can click and ask for a sample of any of our programs. We'll send you a redacted electronic sample of it so you get a better feel for what the programs include. Over time, over the past going on 11 years that we've been promoting Prevention Plus Wellness programs throughout the country and world, we've had a number of adaptations which have worked very well. So for example, we've had other topics being addressed. Original sport and InShape Prevention Plus Wellness programs addressed largely alcohol. Now we have vaping, marijuana, and opioid prevention plus wellness programs, In God's Image, and Sport 2 PPW program. We have organizations throughout the country using our programs not just as universal prevention programs, but for higher risk youth as selected and indicated programs. In other words, very common to use vaping and marijuana PPW programs with kids that have been, with young people that have been caught experimenting with those on campus, for example. So very common to use them in that setting. Now our programs have expanded to younger youth, including children, older populations, young adults with InShape. Some organizations will even use InShape with older adults. Number 4, in different settings: recreation, sports, wilderness settings, juvenile justice, just about any setting where there's youth or young adults. As I mentioned before, U.S. military is using the InShape Prevention Plus Wellness program. They just tailored the slides a little bit. Follow-up strategies have changed. We have additional content on our website, flyers, resources that we provide free for those that want to build upon that single session or reinforce messages that youth get, or provide more resources to youth as well as parents. We've had language translations, like I mentioned earlier, about the Turkish language translation, and online protocols for providing to youth online as well as by telephone. We also have a number of evaluation resources, include scannable pre-post test surveys as well as online surveys, allows immediate pre-post assessment of your screening and brief intervention, includes 2 measures highly predictive of multiple health behaviors, let me see. 2 measures include perceived harmfulness as well as, I'm just having a brain freeze right now. It'll come to me and I will tell you the two key measures. Behavioral intentions, there you go. So behavioral intentions, most highly correlated measure and predictor of future behavior as well as perceived harmfulness. Those are the two measures. And measuring not just one substance use, but multiple: alcohol, tobacco, e-cigarettes, opioids, and other illegal drugs, as well as for behavioral intentions, physical activity, nutrition, sleep, and stress control. And we do provide a free basic analysis of the scan surveys if you send them to us, and we have the optional online goal plan and pre-post surveys. Whew. And also, what else? Pre-post measures, here they are. You're trying to remember it, it's right here in the slide. Behavioral intentions, 4 health behaviors, 5 substance use behaviors, perceived harm or susceptibility, and behavioral intentions, there they are. So both measures, 4-point scale, and post-test. By the way, there's 2 measures, open-ended qualitative measures, getting feedback in the post-test from youth. Very, very important to have that qualitative in the own writing of the youth. Really want to encourage them. What did they like best? What did they like least? Gives you great content for promoting, marketing your program, as well as improving it over time. So what can we conclude from all of these slides I've shown you? Number 1, prevention plus wellness programs address alcohol, e-cigarettes, marijuana, and other substance use prevention, and it's integrated with chronic disease risk behavior prevention. Secondly, numerous differences exist between typical substance use prevention programs and PPW interventions, which highlight the advantages of prevention plus wellness programs. Number 3, theory, research, and practice supports the use of brief as well as multiple health risk behavior interventions for preventing youth substance use, including alcohol, tobacco, marijuana, and promoting wellness lifestyles. And lastly, PPW programs have been adopted and address emerging substance use behaviors, different levels of prevention, and other population settings, languages, and even online use. So lots of development over time with prevention plus wellness programs. You can get free email blasts, weekly blasts, which highlight webinars, free webinars, and other resources on our website. All you have to do is go to preventionpluswellness.com, and there'll be a pop-up window like a lot of websites. Just put your email in and you'll be in the loop. Here's our website. I think this is the most recent view of it. We change it regularly, highlighting one session prevention plus wellness programs, new COVID-19 resources. We address alcohol, cigarettes, marijuana, opioids, and other substances while promoting protective wellness behaviors for youth, for young adults. And we have online training for prevention and health and other professionals. You can find out more at preventionpluswellness.com. You could email us at info@preventionpluswellness.com. And there's our phone number here in beautiful Jacksonville, Florida, 904-472-5022. But if you really want to reach us, just go back to our website, preventionpluswellness.com. In the lower right-hand corner, there's a message us, and just click on that and you can send us a message. Thank you so much. Let me stop at this point and see if anybody has any questions. Whew, that was a lot. We covered a lot of ground there, lots of content. Remember, I'm going to send everybody a link to this recorded session, a copy of a 1-hour CU certificate, a PDF of the slides, and a link to next week's live webinar of this topic. Same time next week. That's May 27th, 11:30 a.m. Eastern, 8:30 a.m. Pacific time. All right, let's check the chat room and see if anybody has any questions or comments they wanted to make. There's a lot of good mornings. Everything's working. Hi to everybody. Thank you for joining us again. Let's see. Will you be posting the slides? Yes, I'll be sending the slides to everybody who's registered. So I won't post them. I'll send them directly to you. So you register with your email, and that's where I'm going to be sending it to your email address. If our organization has been using the 6-session sport curriculum, that's 6-session is a sport 2 curriculum, for our participants. Can that be used for a single intervention also? Well, I would just, I mean, you could do that because you got 6 lessons and you could just choose one of those lessons. I mean, that would be I'm just brainstorming right now with you. That's the logical thing to do. The other thing is you could collapse some of the lessons if you wanted to into a single lesson. So in Sport 2, there's 3 lessons addressing physical activity, 2 nutrition, 1 on stress. So, I mean, you could do, you could address physical activity, those 3 lessons, you could collapse them into 1 lesson. That's going to take some work and some effort on your part. My recommendation is reach out to us and just order yourself a second, the Sport Prevention Plus Wellness program or one of our other vaping or marijuana programs. Happy to give you a discount because you're a past customer, and so that you have that single session intervention. Some organizations will implement Sport and then because they have access to youth, and then they'll add up to 6 additional lessons with the Sport 2 program. And some are now using Sport for 1 lesson, vaping, PPW for another, marijuana, PPW for another. So there's lots of opportunities for different implementation scenarios. If you have any questions, let me know if you want to chat about that, and I'm happy to talk to you about that. Or is it that different curriculum that needs to be purchased? So I gave you some examples there. Also, is Sport available in Spanish? This has been a major issue for us. So the only thing that we have in Spanish at this point is we do have the parent letters in Spanish, so you can get those. But other than that, we have had a number of organizations over the years saying they're going to translate it into Spanish. If anybody does a translation, they should be sharing that with us and getting approval for that. We'll give you approval, not a problem. But we've never received any translation. So as far as I know, it has not been translated. If it has been translated by some organization in Spanish or other languages, please, those organizations should inform us and let us have a copy of that, because that is really our property. So at this point, no, we're happy to work with you to get it translated. So let me know what we can do to help you and what it is that you need to have translated. Remember, you're presenting this to youth, so I'm assuming you have Spanish-speaking youth. So you're going to need a Spanish-speaking provider. So is that what you need? Is that what you need, the actual script translated, the slides translated? Let me know what you need, and what resources you have to help with that. Maybe we could work together to get that done. So that's a great question and comment, and actually a number of questions and comments. So thank you for all of those. Any others? Let me just give you another minute. Make sure there are no other comments or questions related to Sport, which addresses largely alcohol prevention, vaping prevention plus wellness, marijuana prevention plus wellness, or any of our PPW programs. Let me know if you have any questions or comments at this point. Last chance to ask. I'll be reaching out to everybody that's registered with some good follow-up materials, as I said earlier. Don't see anything. I think we're out of time. Thank you so much. Again, thank you for all you do. Keep up the good work. Stay healthy, stay positive, keep making a difference. If we can support you in any way, let us have that privilege to do so. God bless you for what you do. And thank you, and have a great afternoon, everybody. Thanks for joining us. Bye-bye, everyone.